Hi, I talk about severe acute respiratory distress syndrome. Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the blood. Condition characterized by widespread inflammation in the lungs.
What is acute respiratory distress syndrome? Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes that can lead to acute respiratory distress syndrome? Acute respiratory distress syndrome can be caused by trauma, sepsis, shock, gastric aspiration, uremia, acute pancreatitis, or amniotic fluid embolism.
Application in medicine. Don't inhalate chemical affecting our lungs. Go periodically to consult with your treating doctor. Prevent drug abuse or drug overdose. Avoid multiple blood transfusion.
This is Andrew Wolf, and I am going to make a short video about acute respiratory distress syndrome, otherwise known as ARDS. Now, acute respiratory distress syndrome is a disease of lung inflammation, and the inflammation leads to a cascade of events that leads to lung injury. Now, there are a number of different things. The lungs are very prone to injury for a number of reasons, and I'm going to get at that as we talk through this video. Now, the lung inflammation is really centered around the nexus between the capillaries and the alveoli and the thin membrane in between. So this is really a syndrome of inflammation of the pulmonary alveoli and capillaries. Now, it can be caused by a number of things. So, causes or predisposing events. One possible cause is that there is injury to the alveoli. Now, it could be injured by chemicals, like, smoke inhalation. It could be caused by severe burns to the tissue if the person was in a fire and breathed in hot gases. It can be caused by infection, where we have little bacteria and a buildup of pus with injury to the alveolar epithelium. Or it can be caused by the inflammation can start in the capillary side. Now, what's interesting is if you have inflammation somewhere else in the body, so let's say we have a person, this is a gut here, person's gut, and they have ischemic gut because they have the vessel supplying their gut has a big atheroma or an embolus, and it clots the gut off, the blood supply off to the gut, and we end up with ischemic gut. What's going to happen? Well, cells are going to lyse and die, and they're going to release lysosomes into the blood, into the venous supply, and the tissues are going to become very inflamed because of the ischemia. So we're going to have, lysosomes, and we're going to have cytokines from ischemia. And where's it going to go? Well, it's going to go up to the right side of the heart, dump it to the right side of the heart, and then from the right side of the heart, it's going to get pumped to the lungs, right?
Advantage and disadvantage. Advantage. If the disease is treated, a good lifestyle will have. Disadvantage. Lung transplantation can lead to this disease suffer. To don't perform lung transplantation could take away many years of life.
Critical Care Survivor Guide. This time we're going to be talking about ARDS, or the Acute Respiratory Distress Syndrome. ARDS is defined in 4 ways. The first is bilateral infiltrates on a chest x-ray, as shown here. The second way we define ARDS is by looking at the PaO2 to FiO2 ratio. This ratio tells us how severe the disease is. If the ratio is between 200 and 300, we have mild ARDS. Between 100 and 200 is moderate ARDS, and anything less than 100 is defined as severe ARDS. The third criteria we look for in diagnosing this syndrome is a lack of heart failure. That means that there is a low pulmonary capillary wedge pressure less than 18, or a low central venous pressure less than 8, or a low BNP. It's also acceptable to use standard clinical criteria such as clinical exam and imaging to help to rule out left heart failure as the cause of the bilateral infiltrates. The fourth criteria for ARDS is that we need a reason for it. This might be secondary to pancreatitis, or more commonly secondary to septicemia. The list of causes of ARDS is shown here. Our approach to the patient with ARDS consists of maintaining low tidal volume ventilation. This is extremely important. Good studies have shown that if we provide too high a tidal volume or too high a pressure into the chest of a patient with ARDS, will make the disease worse. So we follow these ARDS-NET guidelines.
Disease: pulmonary fibrosis, ventilator-associated pneumonia, acute renal failure, electrolyte deficiency, barotrauma.
Is a set of diseases that cause progressive scarring inside the lungs. Over time, healthy tissue is slowly replaced with scar tissue, which causes airways to be blocked, restricting airflow. This makes breathing difficult and chokes off the amount of oxygen needed in the bloodstream.